everyone. Today, go to the topic of cardiac catheterization. Okay. Last topic we have discussed the cardiac output determination as well as how to decrease the cardiac output. So, in this today topic, what you have to go through is what is cardiac catheterization. Okay. Cardiac catheterization is nothing but where we can able to identify it as another meaning, nothing but angiogram, angioplasty. Have you heard angiogram or angioplasty? Where the angiogram or angioplasty is a procedure or a diagnostic procedure which can be used for in post-angio, means post-viral infection patients. Okay, so the patient get plaque formation in the blood vessel is called as viral infection, right? So then you can able to use cardiac catheterization. Okay, it's a procedure where a catheter is placed where arteries are vein, okay, to the heart. Then we can able to obtain the image by seeing the fluoroscopy vision. Okay, which can be able to assess the cardiac hemodynamics and also what the percentage of the blockage and the blood vessels, whether it is normal or abnormal. Okay, we can identify it. So it is a procedure, it is a cardiac catheterization laboratory, there is a cardiac catheterization laboratory which we can able to assess these are the procedures. There is a left heart catheterization, also right heart catheterization, and also there is a lot of procedures that have been rolled out here. Okay, there the history is venous frozen, okay, postman are frozen, okay, in 1929. As a urine catheter, nothing but urine catheter, we are using used for urine output for the patient of severely affected kidney, aka okay. Where in 1929, Dr. Venner Postman used the urine catheter, okay, where by using local anesthesia or veins, okay. Okay, in the procedure, what he has to do is, he has advanced the catheter throughout the right atrium. Okay, because the picture were placed here. Okay, it's what is the history? In 1941, right heart catheterization or angiography is done for a patient of cardiac insufficiency in 1941. Okay, in 1915, the first retrograde left heart catheterization is done by Pierre. Okay, and then later we can able to use this in our advanced level of equipment through this sensing. Indication, what is the indication? Indication is nothing but if a patient gets suffered by myocardial infarction, then we can able to use cardiac catheterization. So in that procedure, what we have to learn is if the patient has suffered in myocardial infarction, we can able to assess the patient. Okay, and also the myocardial infarction is having the underlying causes, nothing but coronary artery disease, and also there's a abnormal hemodynamic function as well as left ventricular function or abnormal. Okay, in left ventricular function, nothing but severe LV dysfunction and severe RV dysfunction, and also there the cardiac arrhythmia. You know arrhythmia? Arrhythmia is nothing but irregular heart rhythm. Okay, then we can able to evaluate the patient and also use this procedure. Okay, and then valvular heart disease. Valvular heart disease, do you know that valvular heart disease? Where the vessels get affected by the heart disease. Okay, in that procedure, what we have to do is we have to rectify the mistake. I mean the malfunction of the valve and also the valve from the area. We can able to treat this. And what are the indications? Another indication for this cardiac catheterization. Okay, pericardial and myocardial diseases, nothing but pericardial effusion, pericardial cardiac tamponade, and also cardiomegaly like that. Okay, where we can able to use this patient to identify the disease condition. We can able to assess the patient, and then Congenital heart disease. Congenital heart disease is nothing but if a baby birth by birth which can affect her through the disease condition. That mean by congenital heart disease. Then we can able to assess these also, and also heart failure. Heart failure in the previous classes what we have to discuss is heart failure. What is the underlying causes? Cardiomyopathy, valvular heart disease, and then myocardial infarction. Okay, then we can able to assess these cardiac catheterization to evaluate the heart where it is function well or not, and also the indication. If a patient gets sudden cardiac arrest, as well as if a patient undergoing DMT, means segment test, they will go through that in the next PPT. Okay, now if a patient get a TMT, that is a procedure, then we can able to use this treadmill test, and where the patient have walked throughout the period of time, given time. If the patient get a positive excessive tolerance test report, then we can able to assess the patient. Nothing but every 6 months get depressed. Okay. And also, what are the indications? Aortic dissection. Aortic dissection is nothing but you know that aortic dissection, where the aorta gets dissected by two layers, okay, and also the aortic aneurysm. Aneurysm is nothing but the patient where the aorta gets inflamed, seems like inflamed. There is a three types of aneurysm. Okay, there's a three types of aneurysm that we can able to assess it in later period. And then pericardial constriction or a tamponade. Nothing but the cardiac tamponade and the pericardial tamponade which will lead to a same similarity. Okay, and then if the patient get a cardiac transplantation, nothing but if a patient undergo PABP, then we can able to assess the patient by this procedure whether the heart is anything but the cardiac tamponade and the pericardial tamponade which will lead to a same similarity. Okay, and then if the patient get a cardiac transplantation, nothing but if a patient undergo PABP, then we can able to assess the patient by this procedure whether the heart is function well or not. And the contraindication. Contraindication is nothing but the patient get suffered throughout hypertension and also severe anemia, where we can not be able to use this procedure, and also ventricular fibrillation, where the patient undergo ventricular fibrillation. So these are the contraindications that we can be able to not use this patient, and also the acute stroke. Okay, the acute stroke is nothing but if a patient suffered by a plague throughout his or her heart, that means by myocardial infarction. The patient gets suffered by plague where the brain arteries may affect, which called as acute stroke or acute, which means sudden onset of a period. Okay, and then GA bleeding, gastrointestinal bleeding may be occurred. The patient could not be able to undergo the surgery, undergo the cardiac catheterization procedure, and then allergic to contrast. Okay, where this is the procedure where we can be able to use contrast here. Okay, so in this patient we can give contrast. So if a patient get allergic reaction, we cannot be able to give this correct. We cannot able to undergo this. Okay, and the renal failure. If a patient gets a kidney failure, where we can able to known as other ways, kidney failure as well as renal failure. If a patient undergo renal failure, we cannot be able to use this procedure, where we can able to assess this patient by assessing the creatinine level. Okay, if a patient gets creatinine in a appropriate value, we can able to we should know that we should not perform the procedure to the patient. And then constrictive failure is nothing but it's a compression of the heart, where it is a continuous failure occurs during this procedure. Okay, and then infections. If the patient undergo any type of infection, nothing but a bacterial infections or viral infections, which can be lead to bleeding hematoma or something. Infective endocarditis may be lead to complications. And then electrolyte imbalance. Electrolyte imbalance for abnormality is nothing but sodium, potassium, and the creatinine levels may be abnormal. The patient cannot be able to contain, we cannot be able to do another procedures like cardiac catheterization, PCH, okay, and severe coagulation. Severe coagulation is nothing but when patient gets the correlation. Do you know what is the correlation? So when during this procedure you have able to insert the catheter through the heart. So there, if a patient gets a incision in the artery or else vein, where the patient gets the paper should not be active here. There, here the patient gets a continuously loss of bleeding. There is a sudden loss of bleeding throughout the entire body, which cannot be able to done. And the preparation of the procedure. Okay, the preparation of the procedure is nothing but if a patient gets suffered from viral infection, then we can able to use. Then we can able to assess the patient like PCA. Okay, so when we undergo angiogram, there is a procedure called angiogram that we can able to assess the coronary artery, which affected how much percentage there are, so that we can able to further investigate the surgical position, something PBCA, percutaneous transluminal coronary angiography. We can able to assess the patient coronary blood vessels, and then we can able to assess the patient with stenting or protabulation or something else. The procedure, there is a lot of procedure in cardiac catheterization lab, so that we can able to go through the ladder. And now, what we have to do is, that's a procedure where the patient get surgically prepared throughout the entire finger. So, the patient could not be able to get any infection. And what are the basic, in the PPT there is no, I think so there is no included in the, but I will tell you what are the main parts. Yeah. In this lining, we can go through this. So, CBC, where we can able to assess the patient's blood count. There is a patient get leukopenia or HP level gets lower. We could not be able to proceed. These are the procedures. It may be leads to the patient gets death. So we have to know the prothrombin timing level where we can able to stop from bleeding. Okay, and then electrocardiogram and also chest X-ray. Chest X-ray is nothing but we can able to assess the patient if the patients have any megaly. So we can able to assess this patient by watching this. By investigating it by chest X-ray and the electrocardiogram. Okay, electrocardiogram is nothing but if a precaution, yet been taken by an electrocardiogram or ECG, by seeing the abnormal conditions that we can able to investigate period before the surgical condition. Okay, and then the patient with the documentary allergical reactions to radio iodinated and contrast materials. Nothing but here we use the ioxol or ioxanol contrast materials. If a patient gets suffered during this procedure, we cannot be able to, we could able to do antidote that having been given to the patient, but we could not be able to, first we have to know if the patient get allergic reaction or not by taking examination. Okay? So that's one and only key role that every technician should know that. And the patient with the chronic kidney disease maybe get hydrated due to worsen of the renal function. So if the patient, not only patient, everyone should know, everyone should take at least 5 to 6 liters per day or else 2 to 3 liters per day every day for not lead to a renal function failure. What is the procedure what we have done? We have placed a sheath, okay, and also the catheter. In later classes, we will discuss what is sheath and also what is catheter and what are the equipment that we have used for this through the procedure. And then there is a two type of assess where there is vein and also artery. Okay, where we can able to assess the coronary artery. We can able to assess radial vein, radial artery and also femoral artery. And then if a patient, we should go through a interposition, the internal position of heart. If a patient get a VSD, ASD, we can able to approach the patient by seeing the vein access, okay, radial vein or femoral vein access. But here, what we have to go through is we must go through arterial access. So arterial access is nothing but if a patient get a radial access and also femoral access, what we have to go through is we have to know how to approach the patient and also what are the anatomy of the patient, but that we have to go through. So through here, what we have to do is radial access. What we have to, in the breast area, what we have to do is radial access. There is a radial access here. So through the catheter, through the sheath, we can able to introduce the catheter. Okay, where it can be go through by an arm and that will reach to your heart. So like this procedure, this is a sheath that we have to go through. Okay, this is sheath. There is a two type of sheet. One is pediatric and also another is adult sheet. Okay, there is a 6 kinds of sheet there, which is green color. And also where the catheter is inserted over the period of time, what you have to do is, what the doctors have to do is, they are monitoring fluoroscopy. Okay, they are monitoring fluoroscopy. There is an X-ray movement machine. What we have to do is, if a X-ray taken a fraction of a second, where the fraction of a second needs to be a movie, just things like that. Okay, so that's called fluoroscopy. Okay, where the catheter is placed toward the aorta, and then the contrast is injected, which procedure is called angiogram or as angioplasty or angiogram or angioplasty. So nothing but stent is introduced, okay, toward the plaque region, so that we can able to undergo the surgery or else minimal surgery, so that the patient get not to be more complicated in this plaque formation. Okay, and then coronary angiography. Coronary angiography, I have already told you. What we have to do is we have to assess the patient's firstly and also the coronary arteries and also branches and also collaterals and the anomalies. What are the anomalies? What are the difficulties or what are the defects present there? What are the difficult conditions that lead to the patient's death? Okay, and now to visualize this will bifurcation. Bifurcation is nothing but if the patient gets like a, so the the arteries get diverted, which will be called bifurcation. There is a type 1, type 2, type 3 LID. So there is a bifurcation there. We can have to know that during anatomy structure of RCA and also LCX and also LID, we are able to easily assess the patient. And also the origin of side branches, where the origin. Okay, here we can able to access the length and eccentricity and catch in the patients that are present there. And then in coronary angioplasty procedure, there we have to do is this one type of RCA, LCA and LCX, where we can able to LCA. Okay, there we can able to inject the contrast there here. We can able to assess the patient by injecting the contrast. It is more applicative or more opacity that we can able to read the patient coronary disease. Okay, this is right coronary artery, and where there is a left coronary artery shown with the contrast. We can able to contrast if a patient get contrast that we can able to assess the image. Or else we cannot able to assess the image by through the fluoroscopy image. So right coronary artery, where we can able to give a contrast, we can able to assess the patient. Okay, and then other complications. What are the other complications? The patient get infected, it will maybe lead to infective endocarditis, right? If a patient get, if a patient could not be able to stop bleeding, that the patient gets bleeding disorders, like that we cannot able to assess the patient. If we assess the patient too, we can able to, it will be lead to a complication. Okay, there allergy to the diet. So we have already seen that if a patient should not be get allergic reaction during this period, and also we have to give a heparin solution here to not to get a blood get clotted. Okay, and during this procedure, the air should not be get embolized. Okay, so that we have to maintain a proper protocol here. Okay, the whole going through your blood with nothing but preparation. Okay, it will be lead to another complication and also kidney damage from the time. There we have to notice the creatinine level so that we can able to observe the patient's kidney damage. I mean, we should be able to prevent the patient from kidney damage. Thank you.